probable signs during pregnancy. Enlargement of the abdomen. This is probable signs. Enlargement of the abdomen, it is the size of the abdomen during pregnancy corresponds to the gradual increase in the size of the uterus, which of the end of 12 week, the third month, or at the level of the symphysis pubic. At the end of the fifth week month, 22 week, it is of the level of umbilical. At the end of the 14 week, 8 month, it is at the level of xiphoid sternum. Hagar's signs, it means change in the uterus. The uterus is more antifixed. Uterus more antifixed, large, and the lower segment isthmus is the soft to touch than usual occurs 6 to 8 weeks after conception. Hagar size, change in the uterus. Fetal outline. After 20-week outline of the fetus, head, back, knee, elbows can be identified by well abdominal palpation. You can see that in this picture. And we can feeling during abdominal palpation. Ballotment. Ballotment, it means passive movement of fetus. What do you mean that? What's the fetus happened here? When the lower segment of uterus is stopped and by manual examination, the fetus can be felt to rise against abdominal wall. Passive movement of fetus. It is identification at 16 to 18 weeks. Caudal signs, it means cervical change. Due to vascularity, hyperplasia, the softening of the cervix at 6 to 8 weeks. It is like earlobe and become more before the onset of labor. Braxton Hicks contraction. It is a contraction, but it is painless uterus contraction, beginning early in pregnancy, 12 weeks, and becoming more frequent after 28 weeks. Pregnancy test. Early chorionic villi of the implanted ovum, trophoblast, secrete human chorionic gonadotropin, which appear in maternal blood and excreted in the urine. It can be detected early in the maternal serum as 8 days after conception. This level at 8 to 12 weeks, 100, then gradually decline about 10 only. Positive signs. This is the last signs and symptom of a pregnancy. Number 1, fetal heart sound. It is audible at about 18 to 20 weeks of pregnancy by stethoscope. It may be detected early 5 weeks by ultrasound and at 12 weeks by fetal electrocardiograph and 16-week using fetoscope. Normal fetal heart rate, FHR, means fetal heart rate, 140 beats, the range 120 to 160 beats per minute. Number 2, fetal movement is felt by examiner at 20 to 24 week and by mother at 16 to 20 week. Number 3, ultrasonography. Gestational sac will be revealed as early as the 4th to 6th week of gestation, and the 8th week fetal outline can be seen clearly within the sac. Physiological change during pregnancy. Cardiac hypertrophy, increase blood volume and increase cardiac output, 25 to 50%. The increased load on the heart in pregnancy is due to greater need for oxygen in the tissues. The fetal body and organs grow rapidly, and its tissues have an even higher oxygen per unit volume than mothers. So, the increase in heart rate 10 minutes than normal. Increase blood volume in the third trimester equal 30 to 50%. Increase in blood volume of pregnancy, that increase in the heart go to the left. Increase level of blood coagulation factor. Decrease blood flow to the lower extremity. Cardiac muscle hypertrophy occurs so that the heart chambers enlarge and output increase by 14%. During pregnancy, the heart is enlarged and pushed up by the growing mass under the diaphragm. Blood pressure reduces in the mid-pregnancy, but pulse pressure is increased and peripheral resistance generally decreases during late pregnancy. The heart becomes more horizontal, so cardiothoracic rate is increased, and it has a stagger upper the left border. This change can be visualized by cross-sectional echocardiography, which depended on the reflection of high-frequency sound from the inside the heart. So, the pituitary gland is increased in size during pregnancy, mostly because of change in the anterior lobe. The concentration of thyroid hormone in the blood are increased, but thyroid function is essentially normally in pregnancy. طبعا التغيرات الفيزيائية هي التغيرات الطبيعية التي تطرأ على الحامل. وأول الأجهزة التي تصاب بهذا التغيرات في جسم الإنسان هو جهاز الغدد الصماء والجهاز الهضمي والهرمونات. وأول هرمونين يرتفعوا بالجسم خلال الحمل بعد هرمون الحمل HCG هرمون هما هرمون الاستروجين والبروجستيرون. الاستروجين هو الهرمون المسؤول عن زيادة حجم الرحم والجنين والثدي وقنوات الحليب الموجودة بالثدي. أما هرمون البروجستيرون فهو يبدأ بإفراز الجسيم الأصفر بالترايمستر الأول، وبعد هاي 3 أشهر يبدأ بإفراز المشيمة، وهو الهرمون الذي يعمل على التغيرات بالأوردة والشرايين والعضلات والأوتار، وهو المسؤول عن أغلب التغيرات الفسيولوجية التي تحدث بجسم الحامل. زين، هذا الهرمون يرفع من هرمونات الحمل، وهو المسؤول عن عمليات أيض الدهون وإنتاج الجلوكوز حتى يغذي الجنين. وهذا الهرمون اللي يجعل الأنسولين لا يستجيب، لذلك تكون الحامل معرضة للإصابة بسكر الحمل. فدائما ننصح أن تبتعد عن السكريات والكربوهيدرات، وأن لا يزيد وزنها عن الطبيعي للحمل. زين. الصفحة الثانية من المحاضرة تقول إنه الغدة النخامية تزداد حجمها. الغدة النخامية تزداد حجمها، وكذلك يزداد حجم الغدة الدرقية، وتقل إفرازات الهرمونات المنشطة لهذه الغدة. أيضا هذا الهرمون يعمل على زيادة معدل الدم، أي حوالي 1.5 لتر تقريبا. 50% من البلازما تزداد، و20 إلى 30% من كريات الدم الحمراء تزداد، وهذا ما يسمى بالأنيميا الفسيولوجية. وبكل الأحوال هنا الدم راح يكون خفيف، أي البلازما حجمها أكبر من حجم كريات الدم، لذلك دائما ننصحها بعد الشهر الثالث بالالتزام بأخذ الحديد، وأن تنتظم بتناول الأغذية الغنية بالحديد، وهي راح نتطرق لها بالمحاضرة إن شاء الله. الصفائح تقل بشكل فسيولوجي طبيعي، وهذا الشيء ما يخوفنا، لأن هذا شيء طبيعي يتعرض إلى الجسم، الحامل يتعرض له. وعادة ما نلاحظ هناك كدمات خلال الحمل بالجسم، وهذه الكدمات هي نتيجة هذه القلة في الصفائح. ترتفع كريات الدم البيض بس ما تصاحبها عوامل التهاب، لأن هذه physiological change، عوامل طبيعية. نسبة الدم يجب أن نحافظ عليها بنسبة 11. يعني إحنا ليش نريد نحافظ عليها بنسبة 11؟ هو ما يخوف إذا صار 9 أو 10، لكن إحنا خلال ما تفوت صلاة الولادة تستعد للولادة، إحنا لازم يكون 11. حتى شنو؟ حتى ممكن أن تعوض عن ما ستفقده من الدماء خلال الولادة، لذلك يجب أن نحافظ على نسبة الدم 11. الجهاز التنفسي هو أيضا الهرمون البروجستيرون يجعل الحامل معرضة إلى ديزنيا، صعوبة بالتنفس، وهذا إلى أسبابه، وكذلك معرضة إلى احتقان بالأنف، وهذا الاحتقان عادة قد يصاحبه، ليس جميع الحوامل، قد يصاحبه الرعاف الفسيولوجي. أما التنفس اللي ممكن أن يضغط على الحجاب الحاجز، فهنا تقل المسافة المسموح بها للرئة بالتمدد حتى يحصل التنفس الطبيعي. تقل المسافة هنا نتيجة شنو؟ تقدم الحمل وارتفاع الرحم، وبالتالي تقل المسافة بحوالي 4 سنتيمتر، فيكون عادة تنفس الحامل قصير، ولهذا السبب تشعر بأنها لا تستطيع أخذ كمية كافية من الأكسجين من الرئتين. لذلك دائما ننصحها بالرياضة التنفسية، وهذا أيضا راح نتطرق إلى محاضرات المختبر. وأيضا ننصحها أيضا بأخذ مجموعة من التمارين الرياضية اللي هي كالمشي والسباحة واليوغا، فهي كلها تخفف من الضغط اللي يحصل في عمليات التنفس، وكذلك تخفف من آلام الظهر، وتقلل أو تمنع الزيادة في الوزن. ودائما ننصحها بتجنب الرياضة العنيفة، لأن هذا يساعد على حدوث يعني صدمات ممكن للرحم وتأثر على تقدم الحمل. أيضا هرمون البروجستيرون يعمل على ارتخاء الأوتار، يخلي المرأة تشعر أكو ثقل في نهاية الظهر أو ضغط في آخر الظهر، وهذا يساعدنا بالمساج والعلاج الطبيعي، وراح نتطرق إليه في المحاضرة. عوامل التخثر تزداد خلال الحمل، لذلك فهي معرضة أكثر من غيرها إلى التجلطات، لذلك ننصحها دائما ما تجلس لفترات طويلة، ودائما نرجلها دائما تحرك الدورة الدموية من خلال المشي، من خلال الحركة في البيت. فكرة أنه الحامل يجب أن تكون بيدرس دائما، يعني الحامل أول ما تصير حامل خصوصا البرايمي ينصحوها دائما نام بالفراش، وهذا شيء جدا جدا خطأ، جدا فكرة خطأ. لازم تكون لا بالزيادة الأوفر اللي ممكن تأثر على الحمل، ولا بالبيد ريست كومبليت اللي هي نايمة 24 ساعة، لا، تكون معتدلة أو متوسطة بالحركة. الجهاز الهضمي يزداد، هنا شنو تظهر علامات أو أعراض؟ شنو؟ الإمساك. الإمساك عادة ليش يظهر بالحامل خلال الحمل وكذلك بعد الولادة؟ ليش؟ لأن البروجستيرون أيضا يعمل على ارتخاء العضلات الملساء، وبالتالي ما يخلي الأمعاء تتحرك بشكل طبيعي bowel movement ويحدث الإمساك. لذلك تكون معرضة للبواسير خلال أو بعد الولادة أكثر من غيرها. حجم الرحم يزداد 10 أضعاف وزنه خلال الحمل، يعني السعة مالته الطبيعية هي 4 لتر، خلال الحمل ممكن يوصل إلى 4000 لتر، وهذا أيضا يتناسب مع زيادة حجم الطفل والسوائل والمشيمة وكل الأشياء اللي تكونت بالرحم خلال الحمل. زيادة حجم الرحم ايش راح يسوي لنا؟ حيسوي لنا مشاكل أيضا. شنو هذه المشاكل أو العلامات والأعراض؟ تضغط هذه الزيادة على الأوردة والشرايين السفلية للساقين، فيحدث الدوالي، وهاي الدوالي شيء طبيعي تحدث نتيجة ضغط الرحم على الأوردة والشرايين، وبالتالي ممكن أن تتجمع السوائل بالقدمين ويزداد إدرار البول اللي هو بالفيرست ترايمستر، وأيضا يزداد بالثيرد ترايمستر، وهذه الأشياء كلها العلامات والأعراض طبيعية. هاي يسموها الفسيولوجيكال تشينج، وأنا شرحت لكم إياها بشكل نقاط بالمحاضرة لحد صفحة 25. Minor discomforts of pregnancy. Every pregnant woman have minor discomfort. This discomfort, it is not all pregnant women happened during pregnancy, but that related to the hormones levels increase in her body. And not all discomfort happened in all pregnant women. So we have explained the common pregnancy discomfort. This picture appears, this is the common pregnancy discomfort. We divided discomforts related to the system. So the discomforts related to gastrointestinal system is the first number. Morning sickness, it means nausea and vomiting. It's the most common discomfort of early pregnancy due to high level of human gonadotropin hormone or progesterone hormone or maybe emotional factor. These signs and symptoms happen in the morning, therefore take name of morning sickness. And the body of the maternal function and fetal, especially after period fasting from the night to morning. Nursing intervention for this discomfort, nausea and vomiting. It consists of the advising mother about eat high protein snack intake per day, and consists of a cracker or piece of dry twist before getting up, get by bedside if possible. Eat frequent small meals per day with high protein intake foods. Take 60 glasses of water. Drink milk is very important to reduce nausea, and get up from the bed slowly. In the night, give vitamin B6 as possible as doctor order. Heartburn pyrosis. Heartburn is burning sensation in the epigastric and sternal region. It results from relaxation of the cardiac sphincter and the decreased tone and mobility of a smooth muscle, which is due to increased progesterone hormone that is affected on it, and decreased empty time of the stomach, and is very impossible. That is, nursing intervention consists also advising the patient or the mother, to eat frequent small meals. Take high water during the day to reduce discomfort. Take milk and eat slowly. Avoid fatty foods. That's very important. Maintain good posture to give the gastrointestinal tract lots of space. Don't lie down after eating. Constipation. The gastrointestinal tract motility is slowed due to increased progesterone hormone, resulting in increased reabsorption of water and drying of stool. Also may be taken due to oral iron supplement that is the side effect of iron therapy is constipation. Nursing intervention consists advising the mother to drink least at least 6 glasses of water per day, increase the diet of the vegetables and fibers diet, fruits is very important to increase this to prevent the constipation, to moderate the exercise every day, especially walking, maintain regular schedule for bowel movement. Deep breathing and relaxation technique is one of the intervention advice for mother. This picture about musculoskeletal system discomfort. Another system is musculoskeletal system discomfort. Package is caused by relaxation of sacroiliac joint, which is due to increased hormone, steroid sex hormone, and relaxing, resulting in slight joint and muscle relaxation and increase in mobility. So this effect are caused by change in the ability to feel comfort and increase discomfort in the back. Maybe also enlargement of the abdomen and uterus, which is caused package and in the or during the pregnancy, especially it is in the early in pregnancy. Nursing intervention of this discomfort consists of the advice the mother and maternity to prevent standing for long time and take good posture and good body mechanism during the day, and wear appropriate well-fitting shoes, flat shoes, very important, and sleep a position of sleep in the bed that maybe use يعني bed rest on the back on the lateral. It is indicate the kidney or bladder infection may be cause package. The patient must be take the idea about some problem during the pregnancy that may have back pain and should be carefully evaluate that with the hair doctor. Muscle cramps. Muscle cramps are caused by compression of nerve supply the lower extremity due to enlargement of the uterus and increased progesterone hormone. So ask the mother to take calcium and very important to reduce this pain. Fatigue, chilling, or tense body posture is maybe also make muscle cramps. Muscle cramps are not considered serious condition, but they may be quite painful. Take the mother some advice about the exercise and some advice to take vitamin B and D as doctor order to reduce this cramp. This muscle cramp should be lie the patient or the mother to comfortable position that effect on the lung. And the second individual should be apply pressure on the patient's knee, as this picture appear in this slide. Make a pressure on the patient's knee with one hand and sharply flexed the food with the other hand. You must show this picture how the nurse make pressure a knee and sharply flex the food with other hand. With other hand, you saw that. The affected muscle may be also needed for heel or palm of the hand. In this picture or another picture, how to reduce this pain in the muscle crown. Discomfort related to cardiovascular system, vena cava syndrome. Vena cava syndrome or supine hypotension. Supine hypotension is caused by pressure of the gravid uterus on the ascending vena cava when the woman is supine, which decreases the return of the blood. Symptoms include nausea, cold and clammy, feels faint and hypotensive, decreased blood pressure. Nursing intervention consists advise the patient to get up slowly, use the sideline position, preferable on the left side. Varicose vein. Varicosity is an enlargement of the lumen of vein due to thinning and stretching of its walls. So, it is caused the relaxation of a smooth muscle wall of the vein, which is due to increased hormone progesterone, which causes pelvic congestion. This condition is aggravated during pregnancy due to the enlargement of the uterus in the pelvis caused pressure on the great abdominal vein, which interfere with the return blood flow from the lower extremity. It is also aggravated by gravity and bearing down for bowel movement. This may be also be hereditary dispositions. The varicosity is involved the vein of the lower extremities, legs, as this picture. The external genital vulva or labia, the pelvis, and the perineal area, hemorrhoid. Nursing intervention provide advice the mother to avoid obesity, avoid standing for long time, and avoid sitting for long time. Also, assist the mother to avoid constructive clothing. الملابس الضيقة مثل الجوارب الضيقة أو ممكن بعض الملابس تكون تحتوي على اللاستيك الضيق اللي ممكن أن يضغط على العضلات والجسم. They very important to avoid. Elevate the leg when standing or when sitting. Perform moderate exercise as walking. To take treatment to prevent develop the varicose vein. Rest with the leg and hips elevated. هاي خلال هاي الصورة ممكن نلاحظ إنه كيف ممكن أن نضع الساق بأكملها على الوسادة وتثنى والساق الأخرى تكون ممدودة. هذا الاستلقاء يكون جدا مفيد وجدا مريح للحامل. Lie on the bed with the legs extended at the right ankle to the body if ordered by the physician, as this picture. If the vulva may be relieved by placing a pillow under the buttock to elevate the hip, accessing this SIMS position for a few minutes several times per day. Edema is very common during pregnancy, during the second and third trimester. It resulting reduced blood circulation in the lower extremity. It is a generalized edema. It appears in the hand, face, and leg. The nurse advised the pregnant woman have edema as associated by the following. Proteinuria is present of an excess serum protein in the urine, edema of non-dependent parts, sudden increase in weight, hypertension. So the nursing advised mother nursing intervention, maintain good posture, avoid prolonged standing or avoid prolonged sitting, wear support stockings, avoid constrictive clothing, drink a little glass of fluid, natural to prevent edema, exercise that provide increased secretion, urination, treatment of ankle edema, elevated of the feet as possible as with the level of the body. Diuretics is very important, concentrated in the يعني يحتاج الأمر as order. If condition as generalized edema, the patient should be notified her physician, maybe effect on her activities. So when the woman is work in any employment as standing for long time, must be taken some minutes every half hour to prevent accumulation of fluid in the lower extremity. Discomfort related to respiratory system, it is a dyspnea. Dyspnea is caused by limited expansion of the diaphragm by the enlargement of the uterus. The space between the extension of the lung decreases about 4 centimeter. That affected and depended, about the uterus size. It may be increased sensitivity to or compositions for slightly acidosis during the breathing, may be short of breathing during the progress of pregnancy. Dyspnea may be very trouble some in last week of the pregnancy because enlargement of uterus and the effect on the sleep. So the nursing intervention consists of advising the mother to sleep on additional pillows, maintain good posture, avoid overeating, especially at night, stop or decrease in the smoking, limited activity before coming dyspnea, decrease anxiety, and anxiety increase or effect on the breathing, and maybe decrease in the sleep pattern disturbance. Dyspnea is the sudden onset of mother who have heart disease. Also, it's one of signs and symptoms of breathing failure that led to heart failure. The physician should be notified that immediately. So in some conditions and signs and symptoms of discomfort, nasal stiffness. So nasal stiffness it results in increased hormonal progesterone that affect increase this hormone, maybe discomfort during pregnancy. It is not preventable, but it is maybe have some bleeding during pregnancy. Another discomfort related to reproductive system. Leukorrhea is the most common and normal discomfort during pregnancy. It is the white color mucous discharge from the cervical canal or from the vagina. It is caused by increased hormonal stimulation of the cervix to increase this discharge. The nursing intervention depended on the يعني must be يعني avoid the area of the vaginalia area must be drying every time, and must be the mother how to hygiene in the right ways or by step to step. It is not afraid if they discharge white color, this is normal. But if discoloration from to the white or green color, that mean have infection. Urinary system affected during pregnancy, its increased frequency or urgency. A urinary frequency, this is caused by vascular ingogramments and altered bladder function. It's caused by increased hormones and reduced bladder capacity, and also due to enlargement of the uterus and fetal presenting part. The presenting part, that part of the fetus which lie close to the internal or ooze of the cervix. Nursing intervention depended on advising the mother that this is normal during pregnancy, and it is the intake little or limited fluid before bedtime to ensure rest, and where perineal pad it have maybe relaxed from the muscle urination. So the nurse must be advised and educate the mother how to make Kegel exercise. Stress incontinence also present during pregnancy, especially in late period in pregnancy. The teach the mother how to make Kegel exercise. It is the alternate tightening and relaxation or relaxing of the muscle in the perineum. Encourage the mother to empty off bladder every time and use a perineal pad as possible as. Inform the patient to notify any ask the patient the doctor about if the rupture of membrane may be related to the pressure on the sac. Maybe the mother not differentiates between the amniotic fluid leak and urination incontinence, so that affected on the fetus. Stress incontinence, this occur late in pregnancy. The patient may be actually void on herself. Stress incontinence is caused by the enlarging uterus and the pressure on the presenting part of the bladder. Nursing intervention consists of teach the mother how to do the Kegel exercise. Now, another part of lecture is prenatal care. It is the last part. Initial prenatal visit, antepartum or prenatal care is the summary. It refers to the medical and nursing supervisions and care given to the pregnant woman during period between conception and the onset of labor. The prenatal period is the preparatory time for the mother or to prepare herself both physically and psychologically. It is a time of immense anxiety, excitement, and learning. The best way to ensure the health of both the expected mother and her infant is through early and attentive prenatal care. Antenatal care classified into child care, community-based care, hospital-based care. Child care providing jointly by maternity hospital team, general participator, and community midwives. Community-based care provided by community midwives with available involvement in this type of care for low-risk women. Hospital-based care structures program of visits to hospital, which may be well highly specialized. Physical examination after the complete history is make physical examination. Started by vital signs. Vital signs taken include all parts, temperature, pulse, respiration, and blood pressure, fetal heart tone, evaluate height, normal weight, and present weight. So it must be documented that obtain urine specimen. Initial visit must be complete urinalysis done. Subsequent visits urine specimen will be documented if you have any albumin and glucose. Additional tests as needed as ordered. Prepare patient for pelvic examination is if performed. Pelvic examination during or conform to the pregnancy and to determine gestation. Estimate of pelvic size by examiner. Palpate of the pelvic content is done to identify any abnormal masses or tumor. Nursing responsibilities assist most necessary for equipment that used during physical examination. Have the patient or ask the patient to empty of bladder to prevent discomfort. Have the patient to remove the clothes as part as you can allow to easy to examination. With the patient good position or comfortable position depending on the step for examination. So the examination started from the head to the toe and every part, our upper and lower extremities, abdomen, the neck, head, and face also. Provide web soap that may be removed with lubricants used during the exam. Allow the mother's privacy is very important. This is the special steps about how the nursing prepare for examination. The nurse must be observe and palpate patient's breast if have any abnormalities. Rectal examination is very, very important and the aid of the pelvic exam. Laboratory test as last steps. It is consist of the complete blood count, hemoglobin, sickle cell anemia, and patients under treatment or treatment the syphilis, the Rh factor, blood types, rubella antibody, and hepatitis, the AIDS, pap smear maybe need culture for pelvic exam into the floor if they have a presence, gonorrhea culture, herpes simplex culture. This is a common test during pregnancy or prepare for the examination. In abdominal examination, also observe line negligence, epididymium, any signs, any mass, any scar in the abdomen must be taken and documented in the chart. So, what are the objectives of prenatal care? It is important. Number 1, prevention of complication. Number 2, modification of this complication that may be developed. Number 3, support of the patient's goal to carry that infant to term and deliver healthy baby. Number 4, education of the mother to be and her family for their parenting role. Number 4, inclusion of the family as all in the concept of family-centered maternity care. Basic patients teaching, concentration for the expectant mother on the first prenatal visit with the reinforcements on each subsequent visit. Instruct the mother the importance of regularity follow-up visits. Follow-up is the normal during pregnancy. Once month until the 7th month, every 2 weeks during the 7th and 8th month, weekly during the 9 month until delivery. Patient teaching must continue on each visit. Instruct the mother on the importance of proper nutrition. A well-nourished mother and baby are through the far less victims of obstetrics and prenatal complications such as preeclampsia, prematurity, growth retardation. Guide to good eating for the 6 basic food group daily is very important to how the nutrition, how it is the diet must be used, such as the diet picture for basic food groups, number 44 page in the lecture. Prepare weight gain for pregnancy because during the pregnancy it is increased weight, so must no more than the normal level. Instruct the patients on the importance of proper rest and sleep. Pregnancy will causes the patient to tire more easily. Prevention of fatigue through the short rest period to visit to good health. The amount of rest or sleep required will vary with the individual and stage of her pregnancy. Instruct the mother on the importance of exercise and fresh air. The degree will vary according to her condition and stage of pregnancy. Walking is usually exercise as possible as, especially in the green open air from the environment. Swimming also exercise program must be present. Instruct the patients of during pregnancy how to decrease the smoking or must stop any smoking. Restrict or limited alcohol intake. And the Islam country must be that is not present. Avoid children with the muscles or other conditions, disease. Don't change kitty litter box or eat raw meat to prevent toxoplasmosis. Toxoplasmosis, it is makes some problem during the pregnancy. In the third month, may be led to loss of the pregnancy and content from the uterus. Alcohol and the smoker pregnant woman, that also affect on the deformity of the fetus or maybe loss of the fetus, effect on the health of the mother. So this instruct very important, explained during the lecture lab. Lecture lab must be present. Lecture lab of the pregnant woman during the visit to her doctor. The nurse also must be instruct the patient or the mother on what are the danger signs of pregnancy. When the mother look or feel one of these danger signs, must she go to the clinic or to her doctor to treat it or to observe what happened or the pregnancy progress. Discomfort include any vaginal bleeding, that may be miscarriage, abortion, placenta previa, placenta abruptio, and make figure in page 45 in lecture. What are the types of bleeding? Symptoms that maybe indicate preeclampsia. Also, preeclampsia symptoms are severe continuously headache, blurring visions, swelling of the face and hands, especially in the present after resting all night, epigastric pain, sharp pain in the abdomen, continuous vomiting, weight gain more than 4 pounds in 1 week, chill and fever, burning upon urination, sudden escape of fluid from the vagina. That indicates rupture of membrane, RM. Lack of fetal movement over 24-hour period once quickening has been established. Also, regular urination at less than 5 minutes apart for the 4 hour, at least than 37-week pregnancy. This may be indicate for hypertension and maybe indicate of any infection during or in the urinary system. Evaluate the high-risk pregnancy and determine common factor that may be effect in high risk and the causes of bleeding if present during the early and late pregnancy. Outline nursing assessment for management this discomfort, especially in vaginal bleeding, and maybe have the HELP syndrome related to preeclampsia and eclampsia. Examine the pathophysiology of the hydramnios and the subsequent management. So must be a premature rupture of membrane that occurred during the sudden gush of fluids from the vagina. Teach the mother this danger signs especially and avoid it as possible as much. Psychological adaptation during pregnancy. Maternal effect on the emotional response and that effect on the pregnancy. Women are told they should be find fulfillment and satisfaction in the role of the other every giving self-care for health self. So the women or many women experience similar response for emotional associated with their pregnancy, depressed, stress, anxiety. So these response commonly include of emotional for the mother during pregnancy. That may be mood swing and change in the body image. This picture provide adaptation to pregnancy for personal and social support, personal efforts, and environmental factors may be affecting for discomfort, psychological discomfort. So, anti-violence for the realization of a pregnancy can lead to fluctuating response, possibly opposite to the end of the spectrum. For example, regardless of whether the pregnancy was planned, the woman may feel proud and existed at her achievement while at the same time and anxious the implication. So, is a new rule for the nurse to advise the pregnant woman commonly how to reduce this stress during pregnancy. Maybe use and help the breathing exercise and how to take more time for sleep for long time and several times per day. Introversions is focusing on herself as the common during the early part of the pregnancy. The woman may be withdraw and become increasing preoccupation with herself and her fetus. During the first and third trimester, the woman introversion seems into the heightened during this semester. When the woman's focus is on behaviors that ensure safe and healthy pregnancy outcome. Couple provide good rule and provide special rule to support her mother, her pregnant woman, to how to reduce and support her behavioral and should be informed about measures to maintain and support the focus on the family. Acceptance during the second trimester. This is many women will variabilize position feeling about the pregnancy and will conceptualize the fetus. The woman maybe accept her new body image and talk about new life within. Sorry. Mood swing. Mood swing is dependent on emotional lability is characteristic throughout most pregnancies. One moment a woman can feel great joy and within a short time she can feel discomfort and unable to accepting anyone that may be change to her emotion maybe exposure to any events that maybe have crying during the day during the moment sometimes. So the change in the body image affected in the woman's body or her motion and mood and differences from woman to another. Change in the body image are the normal, but can be very stressful for the pregnant woman efforts. So the maternal role tasks ensure the safe passage through the between the mother and nurse and keep accepting for any change in the body and in the during the pregnancy time that is normal and you can reduce to the normal after delivery. Accepting herself and the maternal role infant must be how to bonding between baby and mothers. This is the rule of the nurse. Learning or giving of the first trimester how to get a new rule for the identify with the infant and how to learn to delay any wrong desire for idea and signs and symptom maybe appear result this stress and this emotional mood differences. So this may be very important options most in this pregnancy progress, and the nurse must have some several rule to how to increase the communication between her pregnant woman. بمعنى اللي تكلمت عنه الآن ماذا نقصد به؟ عادة المرأة الحامل تمر بعدة تغيرات نفسية وهذه التغيرات النفسية تأثر عليها وتأثر على الجنين. الحمل هو الحدث اللي ينتظروه الزوجين والعائلة والأهل، وأول شيء يحدث بالحمل أول ما يصير الحمل يحدث هي حيصير تغير بالهرمونات. واحدة من أسباب تغير المزاج للحامل هو زيادة الهرمونات بالجسم، فتكون أكثر حساسة من السابق، تبكي لأبسط الأمور. هذا كلها نتيجة تغيرات هرمونية طبيعية. هذه التغيرات الهرمونية تؤثر على مزاج الحامل. كذلك رؤية الحامل لنفسها، كون زاد ثقل جسمها، زاد وزنها، تغير شكل جسمها أو حجم جسمها، ممكن أن تأثر أيضا على حالتها النفسية. يجب أن يفهم الجميع، الأهل والحامل والزوج، أنه هذه هي فسيولوجية الحمل، هي تغيرات طبيعية، وعلينا أن ندعم الأم الحامل من قبل زوجها وأهلها والناس المحيطين بها. كذلك يجب أن نعمل كجلسات توعية للزوج أو للأهل المرافقين للزوجة، لأن تغير مزاج المرأة يعتمد بشكل أساس على الأهل والزوج، أو على الزوج ثم الأهل. فتغيرات المزاج تؤثر بشكل سلبي على تقدم الحمل وعلى الجنين، لأنها تدخل المرأة الحامل في حالة من التوتر والقلق النفسي. ومن يزداد التوتر والقلق النفسي تزداد حركة الجنين، وراح تلاحظ هذا الشيء. كذلك يزداد نبضات قلبه في هارت ريت، ويزداد ممكن وزنه أيضا نتيجة إفراز هاي الهرمونات اللي تصل إليه، وأيضا ممكن تأثر على حالته الصحية. أيضا تأثر على نوم المرأة الحامل التوتر والقلق، وممكن يؤدي إلى تقليل من تناول وجبات الطعام، أو ربما تفقد الشهية لتناول الطعام، وهذا أيضا يؤثر بشكل سلبي على الجنين. في آخر تطورات العلم ظهر ما يسمى ببرمجة الجنين. كيف ممكن أن نبرمج الجنين جسديا وعقليا ونفسيا داخل رحم الأم؟ هذا يعتمد على الحالة النفسية ومدى تأثر الحامل مباشرة على تأثرها من المحيطين وعلى الانفايرومنت اللي هي موجودة بها، وتأثر الجنين. الضغوط النفسية، الاكتئاب، التوتر تؤدي إلى إفراز هرمونات التوتر لدى الأم، وفي مقدمتها هرمون الكورتيزون، وهذا الهرمون اللي يصل إلى الجنين عبر المشيمة فيؤثر على عملية تشكيل الدماغ، ويجعل الطفل يكون مهيئ إلى القلق والتوتر والمشاكل السلوكية. وهاي شو وقت تظهر عليه في مرحلة الطفولة وإلى أن يصل سن البلوغ. كذلك الهرمونات التوتر تأثر أيضا على شنو؟ على كمية الدم، وعلى كمية الأكسجين، وعلى كمية الغذاء اللي يصل لمن؟ للجنين، فتؤدي إلى مضاعفات كبيرة، منها تشوه الجنين أو مشاكل في النمو، تأخر مثلا بالنمو، أو قد تسبب بدرجة كبيرة وبنسبة عالية الولادات المبكرة.
This is the follow-up visits every 4 weeks up to 28 weeks in 7 months. Every 2 weeks from 29 to 36 weeks. Every week from 37 weeks to birth. This is present in the lecture.
Techniques for fetal movement counts. Fetal movement counts, it is non-invasive methods of assessing fetal well-being. Daily fetal kit counting by the complement woman is a worthwhile adjunct in determining the need for fetal surveillance test in the office time in the pediatric fetal depended on the nurse, and how to provide this educate to kit count. First technique, the woman lie or sit and concentrate on fetal movement until she records 10 movements and the time span it took to achieve this number. She is instructed to notify her health care provider. If she doesn't feel at least 10 movements within 1 hour, further follow-up testing is indicated. Second technique, the woman lies down on her left side for 1 hour after meals and concentrated on fetal movement. 4 movements should be filled within the 1 hour. If 4 movements have not been filled within 1 hour, then the woman should be monitored the movement for the second hour. If after second hour 4 movement haven't been filled, the client should contact with her care provider or nurse provider.
So, Smile, the lecture is over. Thank you very much for listening.